Well, it says we're live. Hello, hello. It's Tuesday. It's 4 o'clock Pacific, 5 o'clock here in Costa Rica, 7 o'clock on the East Coast, midnight in London, 4:30 a.m. Wednesday morning in New Delhi, and 1 a.m. in Warsaw and most of Europe. And I've got it at 9 a.m. Wednesday morning in Brisbane. And for the drum roll, please, New Zealand, it's 11 a.m. Wednesday morning. I finally figured out how to remember what time it is in New Zealand. I'll use my phone. And it's Facebook Live. Hello, everyone. Welcome. Great to see you. Great that you're here. Thank you so much. And our special guest today is a friend of mine that we have been interacting on projects together for a number of years, Ryan Sternagel. Ryan, welcome.
You left out mountain time, Tom. How you doing?
Oh, it's good. It's good. Mountain time. Is it 5 o'clock Mountain time?
There you go.
Yeah. Yes. Right. So we're in the same. I just found out that we are living right above the San Andreas Fault, and I had no clue that it came down as far down as Costa Rica, but it's right here, like within a few miles of where we live. And I thought it was only in California. So we've got our own mountain geography here underground, I guess. I don't know. It was kind of startling. Hello, everyone. Welcome. And first, Ryan, let's give a little background on how, as a layperson, you came into the world of health, holistic-oriented health, and what's brought you to where you are today.
How much time you got?
As much as you need.
It's always the story gets longer and longer by the year, but I think a lot of people are familiar with the initial story. Hey, little guy.
Yeah, this is Gio, and people like to see Gio at least for an appearance every week. So yeah, hi, there's Ryan.
Hey, Gio.
Yeah. Oh, great.
But my wife and I, gosh, what was it? 7 years ago now, a little over 7 years ago, we were already getting into all things, I don't know, natural living, holistic health, getting rid of chemicals in our cleaning products and eating organic and all that stuff. And had our son Ryder, who was coming up on his first birthday. And that's when the world got turned upside down, so to speak. And my wife, Teddy, found a lump sticking out of his back that turned out to be stage 4 neuroblastoma, a type of childhood cancer of the nervous system. So he had a tumor bigger than his spine, a tumor bigger than his kidneys inside of his spine and growing out of his spine, secondary tumors metastasized into his bones. And wasn't pretty for a while there, to say the least. But having already followed a lot of natural health people and having heard a lot about integrative, alternative, et cetera, approaches to cancer, we, I guess, had a bit of a head start in terms of knowing where to look and all the different rabbit holes to go down and that sort of thing. I think it is weird timing. The very first Truth About Cancer documentary series, the original version of it came out I think under 2 weeks after we got that diagnosis. So that was a big springboard. We were just sitting there with pen and paper and taking notes and following up on different treatments we heard about and practitioners we liked and all that stuff. And long story short, that led us to what we do now 7 years later. But we started putting everything we were doing out there to Facebook originally just for fundraising purposes. Young parents didn't have a lot of money to our names and that sort of thing. And all the stuff we were learning about certainly wasn't free, but where there's a will, there's a way. So we just started putting everything we were doing out there to the world. And that led to us being able to afford tens of thousands of dollars in supplements and treatments and energy medicine devices and infrared saunas, and it's the whole bit. And the journey took us a lot of different places. We moved from Washington State, where we got the diagnosis at the time, to we're living in Park City, Utah now. It was actually for health freedom that we moved, to be able to choose how much conventional treatment went into them, how much was enough, when do we stop, do we have a choice in that matter, that sort of thing. That wasn't the case in Washington. It was at least more of the case in Utah. And ironically, now we're all fighting for our health freedom here 7 years later.
Right. And
But
what is your son's status today?
oh, he's doing great. He's yeah, that mass that I mentioned, it's the secondaries are gone. The primary that was just massive, there's still a little bit of residual scar tissue that shows up on MRIs, but you know, it hasn't done anything in several years. His conventional oncologist, I think he's moved him down to, you know, every 6 months to every year to, excuse me, I think this next one's going to be a year and a half. And I think after that, he doesn't even want to see us anymore. So yeah, we're feeling good about everything on that front.
You and your wife would have done the research to look at what the odds were for a 1-year-old with that type of a diagnosis. And where did he sit at that time in his likelihood of living a full and productive life compared to where he is today?
Yeah, and you know, it's a good question, because the survival rate, so the stage 4 high risk, it actually gets, yeah, high risk, which he would have been a high risk diagnosis had he been diagnosed after 1 year old. But the diagnosis came before 11 days before his first birthday. And there was a couple other factors that could kick you up or down. But the high risk diagnosis, that's more of a 50-50 odds. The intermediate risk, which he did get put into, is more of a high 80s. But the thing with that is, you know, these kids, you look up late effects or secondary effects from the treatment, and it's almost, I forget the exact percentage. It depends on what study you're looking at, but virtually every kid that undergoes the works when it comes to conventional cancer treatments, they're almost guaranteed to suffer multiple secondary chronic illnesses, including second cancers. Because I mean, you asked living a full and productive life, those odds were a 5-year survival rate. I don't know, I don't think they have. I don't think they would care to track the full and vibrant health odds if they were able to even. But yeah, that was our thing, is, you know, we're from the beginning and putting everything we do out there, not necessarily saying that you should never consider any conventional treatment, but it's got to be a holistic approach. It's got to be well educated. It can't just be one size fits all for everyone, because I mean, when we moved from Washington to Utah, that was halfway through the amount of conventional therapy that he was, just the baseline amount. That's even, you know, I don't know. It's a long story and finger pointing and who said what when and all that stuff. But he was slated to have at least as much more than he already have by the time we got here, and possibly quite more. So we cut off at least half of what he would have had. And you know, and obviously we had a whole slew of doctors and family members and friends, and more friends than family members, I'd say. But you know, a lot of people saying we were crazy at the time, and here we are over 7 years later, and it seems to be the right choice as far as at least a 5-year survival rate is concerned. And I think we'll be proven right on the long, healthy, vibrant, productive life as well. Yeah.
So I've taken the first 10 minutes to do this so that everyone understands who we're talking to. You know, our guest today is someone who's been living in the trenches, scared out of their minds as to what are we going to do here. Already was looking at and probably understood, I'm going to put some ideas in out of your mouth, that you knew that probably some foods were healthier for you than other foods at that time. You may have been doing a couple of things to be healthier, but nowhere near the specificity and the dialing down that was required to turn around the direction of your son's health. And so now today, you are one of the people out there in the world that delivers information that's no nonsense, no bull. Here's the science. Here's what you're going to hear every day, but here's what the science says. And I've loved the way that you put things like that together, you know, because when people listen to you, they know that there's no nonsense here. And so I appreciate that a lot.
There's some rambling at times, but no nonsense. Yeah.
Well, you're not a polished professional speaker, which is great. I mean, people like to hear authenticity, you know, and I mean, we're all in the trenches to some degree or another. And so sometimes it may not, for me, it's always the case, you know, it's not polished. It's just whatever comes out, right? And it's not rehearsed. But I do appreciate your messaging and what you do. So you've got an event coming up that I wanted to let people know about. Can you tell us a little about this event?
Well, that stems from our third chronic illness diagnosis in a child. Ryder was also diagnosed on the autism spectrum when he was around 3 years old, likely due to the conventional stuff that he did have. We pretty much knocked that out as well. He's somewhat of a savant, genius, quirky little guy now, but that's a nice side effect. But yeah, that our third child and second son, Rocky, recently went through a high-grade eczema diagnosis. And that was, at least with the cancer, we'll never know exactly what caused that. We have our suspicions and all that, but at least we're pretty darn sure we know where the eczema came from. My wife, Teddy, was, we had Rocky in a birth center, all natural birth, holistic, midwife, all that stuff, and seemed to be going fine. And then the day after the birth, she started going downhill really rapidly. And there was a little while there where people say, well, your third pregnancy or your third delivery just kind of beats you up a little more, and you know, she'll feel fine in a day or so, but she just kept going down to the point where, like, that night she just rolling from her back to her side was severe agony for her. She's screaming out in pain and everything. So, I mean, we knew something was a little more than just a third delivery beat you up. And got it, had Rocky in a birth center, but here we are going to the hospital and trying to figure out what was going on. And turned out she had a postpartum group A strep bloodstream infection. She went septic with group A strep, and I didn't know much about that particular infection, but apparently a third of women that get that postpartum don't make it, and it was proving to be highly resistant. She had the works thrown at her, antibiotics wise. She was on everything under the sun, IV for several days in the hospital. This was through Christmas. And it was very, very reminiscent of the cancer diagnosis, because here I am in the hospital fighting with the doctors on why can't you do IV vitamin C? And, plenty of research on that. And they were giving me a hard time about that. I was running all over town, buying whatever herbs and all that stuff I could get my hands on. And finally we did knock it out, but thank God. But the kind of background, the background discussion was we just had this baby, and we know about antibiotics in the gut and all that sort of thing. And I still don't know if there was a right answer, but on the one hand, it was like, do we not breastfeed him and just have him be a formula baby for the rest of his life, or for the rest of the time that he would be breastfeeding, or do we do everything we can to protect his gut and hope that not many antibiotics make it through the breast milk? And we were, of course, consulting with a lot of integrative doctors and that sort of thing. And finally did make the decision to go ahead and breastfeed and just do the best we could. And that did result in his gut getting wiped out and him developing high-grade eczema. So yeah, he looked like it started just, little patches here and there, around a few months old, and it blew up into him looking like a head to toe burn victim for the a few months from there. And I don't know, from kind of just a general wellness functional type perspective, he just had more of an ashen complexion, not that bright, vibrant newborn baby, especially in our house in a non-toxic environment in the middle of the woods with no EMF and organic diet, all that stuff. Just not what you'd expect. As his hair was kind of thin and wispy. And so anyway, yeah, that led to us going down a whole new journey of healing him from high-grade eczema. And I'll detail that journey in a minute, I guess. But yeah, the event that resulted from it was the Eczema, Psoriasis, and Skin Disease Masterclass, which we partnered. My wife and I. This is kind of neat. It's not. We've done some just summits of 30 to 50 interviews in the past. You obviously know a whole lot about those. Dr. Tommy put out a lot of great ones. And you put out a lot of great master classes. You've got experience with both, but yeah, no, my wife and I partnered with Dr. Eric and Sabrina Zielinski, good friends of yours, I know, and kind of made it a little different in that we really wanted to hold people's hands through it and just kind of get rid of a lot of the stuff to wade through, and just, like you said, kind of cut right down to what's most important. And especially I'll talk about it in a second, but we found with eczema, even and a lot of other related skin diseases, even within the natural or integrative health world, some aspects it's more than just heal your gut and everything will be fine. You know what I mean? And so we really wanted to kind of hammer out, okay, here are the most important things. And so, yeah, my wife and I, it's a 7-part masterclass featuring a daily video of my wife Teddy and I, a daily video of Dr. Eric and Sabrina, and a few supporting expert PowerPoint presentations. And it came out to be something we're really proud of and really looking forward to getting out there to people.
Very nice. So this is really a master class for those that are interested more in the health of their skin. And if they or their family or their friends have any type of skin issue, I'm assuming that you're going back to the very basics of what healthy skin is and how our platform, our foundation for healthy skin gets disrupted by lifestyle, by environmental triggers, whatever they are, and that what does it take to identify those triggers and for an individual, and then what it takes to put that inflamed skin into remission, to calm down the fire that's there.
Indeed. Yeah. And it's, eczema, eczema, psoriasis, rosacea, a lot of these are autoimmune type conditions. And so that's actually one thing we've discovered is people going through chronic conditions that, maybe, I don't know, the more quote unquote serious ones. When we talk about more of a full blown, autoimmune condition, cancer, et cetera, the reason we even ended up making this into what it was because, we've got primarily a following of a lot of people going through cancer. And we started putting out what we were doing, what we were going through with Rocky. And we've never gotten the response that we had to the emails that we put out about a skin condition. So it's like, we realized that, we started looking into the numbers and found out that just a whole huge percentage of people, whether or not it's like the biggest thing on their minds, a lot of people are going through skin conditions, skin disorders of some kind. So yeah, we just wanted to make it more of a thing that people could come to get resources on and find out exactly what causes it and how to turn it around. Like you said, it's, it can be an issue from something like a lot of these different conditions resulting from things in the gut, things going wrong with your functional blood work, that sort of thing. But then also, again, you're in my favorite topic, the environment. It's your skin. It's absorbing all this stuff, right? What's going on to it? What's it being exposed to on a day-to-day basis? So,
let's start with the first question that's come in from Melanie Donis. She says, is urticaria a kind of eczema? I had urticaria for almost a year, but conventional doctors here in Guatemala do not know what causes it, and they have given me only antihistamines to control it. Looking for tips on how to heal it, since apparently I'm on my own on this.
Urticaria. I just tried to Google it, but
hives. It's hives. And Melanie, urticaria is a immune system response. It's hives. And when people break out in hives, they're reacting to something. It's in lay terms, you say it's an allergic reaction. But an allergic reaction technically means an IgE reaction. That's one of the branches of the immune system. And it's often not an IgE reaction. So I avoid saying it's an allergy, but it's a response to something in your environment. So when you're exposed to something in your body's response mechanism, you respond with hives. And one of the very common, of course, everyone's going to predict what I'm about to say. One of the very common sources of urticaria is a sensitivity to wheat or to dairy. They're very, very common. And so we always start by testing people there. But Ryan, let's move, let's let you throw something in on this question about hives, about urticaria.
Yeah, I would, again, you obviously know a whole lot more about urticaria and hives than I do, but I would just throw in that, yes, reaction to foods you're sensitive to, wheat, et cetera, but we found a whole lot of interesting stuff on it. It's not necessarily the cause of eczema, but once you have a case of eczema or a lot of different skin conditions, it's really weird environmental factors that can flame it up. Like nickel, for instance. If you have like a belt buckle with that has too much nickel in it, that can flame you up, or your wristwatch or something like that, or even like just otherwise perfectly natural stuff like grass or sand. It's everyone loves laying on the grass, but if you've got a skin condition, that can be what can flare you up. So I'm trying to think of the best way to reference this. We actually put together a guide, and it's the top 10 hidden triggers for skin flare-ups, and it's part of the event. I wonder if I can find a link to it or something and put it here. But yeah, I in going through that, and of course, we were just researching eczema first, but then we started finding crossover to all these different skin conditions and how a lot of them had so many commonalities, and that's why we made it not just the eczema summit, but masterclass, but eczema, psoriasis, and skin disease. Yeah, I'll actually try to pull that guide up real quick and just read them off. But yeah, you can jump in for a second while I'm trying to find that.
Yeah, you bet. So the first thing I want to say to Melanie in Guatemala is, what time is it there? Is it the same as here in Costa Rica? It's about 5:24 here now. So type in an answer so I know what time it is in Guatemala, please. And secondly, this is a really good example that at one level of thinking about this, about skin conditions, it doesn't matter what the skin condition looks like. What primarily matters, of course it matters, but what primarily is important to focus on is what are the triggers that are causing the inflammation that's manifesting in your skin. You know, it doesn't matter if it's acne or psoriasis, eczema or urticaria. It really doesn't matter. Let me see if I've got this here. I was looking it up just beforehand, and yep, I do have it. So I'm going to share my screen here if I can. Can I? Yes, I can. Good. And I was looking at a study before we came on here today. And I just want to show you this study on celiac disease and skin manifestations. Now look at this table from this research study of all the different type of skin conditions. And then the column on the right are the name of the authors of the studies for each one of these conditions. But all of these different skin conditions can be caused by a sensitivity to wheat. And you see psoriasis, vitiligo means you don't have the color, you get these white spots on your skin. Urticaria, there it is, the third one, Melanie. Urticaria, that's hives. And the list, porphyria, alopecia areata means when you're losing your hair. All of these different, so someone who comes into the doctor with erythema nodosum is going to have a very different presentation than someone that comes in with psoriasis. But it could be the same trigger that set up both of them. That's the point I want to make, so that when you're looking at this masterclass, and we'll put a link here today for the masterclass that Ryan and Dr. Eric are doing together. When you go through this masterclass, what you're learning is, this is table 1 about celiac disease, about wheat. Well, in the masterclass will be table 2 about dairy, table 3 about EMFs, table 4 about chemicals in the food chain, table 5 will be nickel. You know, the list goes on and on. And so I wanted to show you that article just so that you can see it's not the case that one exposure, one particular trigger sets off this type of skin symptom. That this one exposure can set off an array of different skin conditions. It just depends on what your genetic vulnerability is as to how it's going to manifest. Many of you have heard me say before, if you pull at a chain, it breaks at the weakest link. It's at one end, the middle, the other end, it's your heart, your brain, your liver, your kidneys, wherever your genetic weak link is. So if your weak link is the skin and the pull on the chain is inflammation, then if wheat is causing inflammation in your body, pulling on the chain and manifests at the weak link, your skin, or dairy, or corn, or lectins, or so many different possible triggers. That's why this psoriasis, eczema, and what was the third one?
Skin disease.
Skin diseases. This master class is going to be so useful for you or your family members who have an interest in learning more about healthy skin.
Yeah, I pulled up the list that I had put together. It was rubber, nickel, clothing, and textiles of all sorts. So I mean, we've been big on just not wearing polyester and artificial materials and clothes for a long time, but that can really flare you up if you do have a skin condition.
Ryan, could we hold, Ryan, could we hold there for a minute, please?
Yeah.
Because people don't know that when you buy a new shirt, that shirt has been soaked in chemicals to keep bugs from eating the shirt. while it's in transport. And these flame retardant chemicals that are in your nightgowns, your baby's, the sheets on the baby's bed, these flame retardant chemicals outgas. After 50 washings, they still outgas these chemicals, minor amounts. But if you have a sensitivity to those chemicals, that could be the trigger that sets you off. So when Ryan says clothing, you may not know that what he's referring to is all of the chemicals that are used in making this clothing, shipping it to you, making it permanent press so it doesn't wrinkle, you know, whatever the chemicals might be. I'm sorry to interrupt, but I want to make sure people understand what you're talking about there.
No, I take this stuff for granted sometimes because we've been just so knee deep in it, just living the lifestyle. You're very good at elucidating these things, Dr. Tom. But yeah, and actually that's a real pet peeve of mine is flame retardants you mentioned in children's pajamas.
Yeah.
They're drenched in flame retardants, and it's just along with their, like if you get a sleep sack or something for them, or a crib mattress, or all this stuff, it's just off-gassing formaldehyde from these flame retardants, and it just drives me crazy. And I guess we're still living in the 1700s where children were sleeping with a candle by their bedside or something. You don't want to, you don't want their sleeve to catch on fire. It's crazy.
Yeah. I can't think of a reason to use flame retardant chemicals anywhere around where we're sleeping, in our bed sheets, in our down comforters, in our blankets, in our children's clothing. I have never heard of a child whose life was saved in a fire because they were sleeping in flame retardant chemical soaked clothing. I've never heard of anyone being saved by that. It's a toxin that's unnecessary. Everything we buy for Geo is organic cotton, everything. When friends send us gifts, if it's polyester, we say, oh, it's beautiful. Thank you so much. That's a very kind thought. He'll never put it on. I won't put it on him. But people don't know, and they want to do something nice for you, and so they buy something that looks nice, and they're doing their best to be, to express their love and congratulations. They just don't know that it's a poison, right? Okay.
And that is okay. Yeah, we're comfortable now being the weird ones that are always being annoying and saying no to things, and no, I can't do that, or I can't go there to eat with my kids, and can't go to this party, or we're gonna. So yeah, it's just, but I enjoy it now. You know what I mean? It gives you something different to talk about.
Yeah, you bet. You know that you're protecting your child. I'm going to ask everyone out there, what do you do for your health that your friends think you're a nutcase to do? What is it that you do? Let's share a few comments here. And then I'm going to go to another question here, Ryan. This is from Shanquilo. She said, hi, what can cause homocysteine to drop? 7 months ago, it was 7, now 4. Functional doc has me taking 10,000 micrograms of B12 daily and weekly injections and detoxing. Can you overdo methylated B vitamins or detox? How can you raise homocysteine levels? Thank you. Well, that's not really a skin question, Shanquillo. But I'll take a stab at it, and then Ryan can also, if he likes. You've got to do an organic acids profile to find out where in the pathway of homocysteine metabolism is there a breakdown. When we think about metabolism, this is true for your brain hormones called neurotransmitters, your enzymes that you make. Every process that your body does is a multi-step process. So think about if you look at an oil refinery. And if you look at this oil refinery, there's big tanks and there's all these pipes that are going everywhere from one tank to another. Because, that crud that comes out of the ground, that black crud, you can't use that in your car. It's got to go through a refinery. And what comes out the other end in the last pipe is this golden liquid we call oil, right? But the oil that comes out of the ground looks like crud. So there's a step-by-step process through all these tanks and through these pipes that you have to do. Our bodies are the same way. Every step in our body's manufacturing of enzymes and hormones and neurotransmitters, and homocysteine is just a step in the pathway of making ATP, the energy in every cell of your body. It's critically important, and usually the problem is it's too high. When it's low, you've got to go back to an organic acids profile to find out where's the blockage. What pipe is the valve too tight, and so there's not very much coming through, and that's what you'll have to open up. Ryan, do you have any comments to this question?
What he said.
Okay. Maggie asked, how did you survive the stress you were feeling with your child's health?
That is a very good question. It's the same. It was the same with Ryder as it was for Rocky, in that I think our MO throughout both of those ordeals was that we have too much to do. We have too much to get done to be stressed. You know what I mean? Like we can come back and worry about worrying later, but right now, I know he needs to get these labs done. I know we got to get these supplements ordered. I know we got to figure out how to implement a protocol. And really that was, it was kind of just, we just drowned ourselves in the work of healing, and really just, like I said, just, maybe we'll come back to being worried later, but we knew there was, and I guess that also speaks to just the knowing that anything can be healed and reversed. And, we had seen going through cancer, we had seen, and I just, just flooded ourselves with podcasts and interviews of survivor stories and just really crazy survivor stories too, of people turning even the most horrific diagnoses around. And so we knew it was possible. And so just knowing that it can happen, I think it was kind of enough for us. And I'm not saying that we never had a bad moment. There were times where I'd lost it, but just made sure to do it in a room by myself, and then got it together and was the tough husband and all that stuff with the family. But yeah, I mean, for the most part, it was just knowing that it can happen and working towards making it happen.
Yeah.
Sounds too simple when I say it like that, but
well, no, it's not simple. It's just it's authentic, is what it is. To have a severe blood infection, a staph infection, that 50% of people don't survive, and to have sepsis, 1.7 million people a year get sepsis in the US, of which 250,000 about die. It's number one cause of death in hospitals in elders is sepsis, because they've been accumulating a lot of these toxins for so many years. Little bit here, little bit here, little bit here. Many of you have heard us talk about LPS, and that is the toxins from bad bacteria in your gut that accumulate in your spleen and your liver and your joints and your muscles. And over a lifetime, that accumulated debris adds up. So to have it in a 30-something mother in a second pregnancy, I think, it's very serious. Third pregnancy, very, very serious. And that this couple was able to not only survive that, but to conquer it, and following their doctor's lead, because this was life-threatening and you've got to do what the doctors say for the antibiotics and all that, but also just pounding the pavement to find the vitamins and the herbs and things that Ryan knew, that he had heard about, that would help. And I think people now understand why I really love supporting you, Ryan, and everything you do, because your message is boots on the ground, that people, you know, when push comes to shove and your child's life is at stake, you do what it takes to find out what can help. And you've done it successfully now with 3 different conditions. So kudos to you guys for what you're doing.
Appreciate it, Dr. Tom. And apologies, I'm at this weird time of the day where the curtains drawn are too dark, but too up, they still light. So you keep seeing me adjust. That's
Yeah, thanks. Oh, thanks. Understood. What labs are you referring to for skin disorders?
We were working with, we are working with Dr. Sheila Kilbane. And she, yeah, I mean, it's the standard, I guess you could say, blood work, organic acids tests, gut, gut, what's the word I'm looking for there?
Microbiome?
What's that?
Biome
analysis. Yeah. Yeah. So yeah, and those things were, I mean, so again, it's coming back to it's not one specific test for eczema or something like that. It's just diving in and seeing what's wrong on the inside and fixing it. And he had a couple things that were really out of whack. I mean, he was super deficient in zinc for some reason. The bile in his stool was, and you probably know the acceptable range better than I do, Dr. Tom, but it was, I mean, it should be somewhere near 0. And he was at like a 70. And Dr. Sheila said that was the actual worst case she'd ever seen of that. So he was just not processing fats whatsoever. He had parasites, at a 1-year-old having parasites, which is kind of crazy. But you know, those things have all now resolved, and explains why he's doing a lot better, I guess. But
so the testing that you're referring to, it sounds like it's, and I don't want to put a label on it, but it sounds like it's a functional medicine approach, which is looking to see what's not functioning right. Is there too much of this? Is there not enough of that? And unfortunately, there's no one thing to look to for skin. One of the most important ones, and really grateful that you found that, was zinc. Zinc's really important for skin conditions and commonly is of benefit in different skin conditions. Brandy has a question. What's the estimated number of Americans that have an autoimmune disorder but don't know it? Well, Brandy, that's a really, really interesting question. So an autoimmune disorder is different than an autoimmune disease. So an autoimmune disease is when you've had an autoimmune disorder for many years, killing off cells, killing off cells, killing off cells, killing off cells, until you kill off enough cells that tissue can't work right anymore. So if it's your thyroid, for example, you don't feel when you have elevated antibodies to your thyroid, killing off thyroid cells, killing off thyroid cells, you don't feel any of that until there's enough damage to the thyroid that now the thyroid can't work quite the way it should. And now you have some type of thyroid dysfunction. And when you get tested, you may find some elevated antibodies, you may not, but it may not be enough yet to qualify you for a diagnosis of an autoimmune disease of Hashimoto's thyroid or Graves' thyroid. And the doctors say, well, let's wait and see, let's keep an eye on this, it's not too bad. And well, what's he waiting for? You know, he's waiting for it to get worse. So then he can prescribe a medication because that's what he's trained to do. So the world is called predictive autoimmunity. And that's what my first book was about. The Autoimmune Fix is about predictive autoimmunity, meaning you can predict where your system, where the weak link in your chain is, if you do the proper type of testing to screen and see, do I have elevated antibodies in my body right now? So your question, Brandy, is how many people are on the autoimmune spectrum? And I don't have a study for this. I'm just going to tell you my clinical experience. And my clinical experience is based on running the tests to see if you have elevated antibodies to your own tissue. We'll put the link here for the test called Cyrex array number 5. We'll post the link here so that you can look for it. It's the multiple autoimmune screen. And it looks at 24 different tissue antibodies, 6 to your brain, 2 to your thyroid, 4 to your heart, your stomach, your liver, your bones, your reproductive system, to see, do you have elevated antibodies killing off cells, killing off cells, killing off cells, which would mean you're on the autoimmune spectrum right now. You may not qualify for an autoimmune disease yet, but you're on the autoimmune spectrum. I'm going to give you an example of that, and then we'll go on to the next question. Most doctors will tell you the most common antibody, if they're doing a screen for antibodies to your own tissue, the most common one is called ANA, anti-nuclear antibodies. And depending on the study you read, between 20 to 28% of healthy people have elevated ANA antibodies. Now, ANA antibodies, anti-nuclear antibodies, mean the immune system is attacking the nucleus of your cell. What cell? Any cell. Every cell in your body has a nucleus, so it can be your thyroid, it can be your brain, it can be your kidneys, it can be your joints. ANA antibodies can attack the nucleus of any cell. And 20 to 28% of healthy people have elevated ANA antibodies, meaning the immune system's attacking your cells. Now, why would it do that? We know that a number of different chemicals that you're exposed to, if your body can't detox and get rid of them, they get stored in your tissue. And where do they go? They go into the nucleus of the cell, way down deep into the center of the cell. For example, mercury. Mercury goes into the nucleus of your cells. You'll get ANA antibodies, but you're healthy, but you're accumulating mercury. Now, in one study, 418 people with elevated ANA antibodies and were healthy. Within 3 years, 87% of them were diagnosed with an autoimmune disease within 3 years. And the most common one was lupus and then scleroderma. But the point is, almost 9 out of 10 people with elevated ANA antibodies are diagnosed within 3 years with an autoimmune disease. So they're not okay to have elevated ANA antibodies. And you have to explore, where are they coming from? Do I have mercury toxicity? Do I have petrochemical toxicity? Oh my gosh, I'm a beautician. I've got my hands in these chemicals and I'm breathing them every day, right? You know, you have to find where is it coming. Just like with Ryan's children, you have to find out what are the triggers setting it off. What are the triggers setting it off? A question for Ryan. Did you use homeopathic remedies at all for your son's skin problems?
Yes, we did. I would be reticent to start listing off a bunch of them because a lot of them were prescribed specifically for Rocky and not just based on he has eczema, so he needs to be taking these homeopaths. It was more, what types of symptoms is he displaying and that sort of thing. I will say that just, our layman's, he's going through some sort of histamine reaction right now. So maybe throwing some histaminicum. I think that's histaminicum. That actually did seem to have an effect whenever we just cut it down to the bare bones of let's see if this kind of tamps down his flare up right now. And a lot of times that did. The other thing that I would mention that we did not around that we did not go down ourselves, but we heard from a whole lot of people that they had really good success with it, was the NAET, the natural allergy elimination therapy.
Narumbad, allergy elimination therapy. Now, it's her name is Naurimbad.
Oh, why did I always think that was, well, all right, there you go. But yeah, I mean, that's just for allergies in general. But, when we think of eczema, skin disease, or, any kind of autoimmune type situation as a reaction to something, heard from a whole lot of people that they had real good success with that. It was certainly on our list of things to try if we needed to, but never made it there.
Right. That's a really good point. There's lots of good evidence that that's an effective tool to use to help. Absolutely. NAET. Jennifer has a question. What are some markers on blood work to look at for skin issues?
Yeah, I'd probably kick it over to you, Dr. Tom. We worked a lot with our functional medicine doctor, and she, I'm not the guy who well, I'm very analytical, but in terms of specific things, I kind of get my marching orders and I track them down.
So Jennifer, markers of inflammation. Once again, if you think of pulling on a chain, if somebody's weak link in the chain is their skin, that's where it's going to manifest, and the pull on the chain is inflammation. Always. It's inflammation. Every chronic inflammatory disease is a disease of inflammation. At the cellular level, the cell is always on fire. Just a question, is it a kidney cell or a brain cell? Is it gasoline or kerosene? But it's always fire. So the first thing you look for when someone presents with a health concern of the weak link in their chain is the skin, the first thing you look for are markers of inflammation, always. Next, zinc. As Ryan said, zinc is critically important, and zinc insufficiencies, maybe not outright deficiency, but insufficiencies, meaning they're hugging the lower end of what is considered the normal range. I don't ever want to be at the low end of normal. On any test that I do, I want robust, vibrant levels of all of my nutrients, my enzymes. I don't want to be just getting by, at the bottom end of what's normal. So zinc is a critically important one, and the inflammatory markers are the first two that I would look at. The third thing is the microbiome, always the microbiome. Now, many have heard me talk before about one of my mentors and friend, Professor Alessio Fasano at Harvard. We think this guy's going to get the Nobel Prize because he's the one, he and his team have been talking about the leaky gut since 1997 and have published many articles on how it contributes to, and it's the gateway in the development of autoimmune diseases. He wrote a paper that said all disease begins in the, quote, leaky gut. All disease begins in the leaky gut. The role of zonulin, that's the protein with leaky gut. The role of zonulin in the etiopathogenesis of chronic inflammatory diseases, meaning how they begin. Chronic inflammatory, every disease is a chronic inflammatory disease. And where does it begin? It begins in the gut. This is what the gastroenterologists and the immunologists at Harvard Medical School are being taught right now. All disease begins in the gut. They're all being taught this. Now, whether they pay attention or not is going to be, in the years to come, we'll see. But the projections are that our doctors coming out in this next 10 years with the highest level of education are going to be so much more comprehensive than doctors in the past, because they're being taught this basic concept, and it's much more sophisticated than what we're saying here. But the basic concept is all chronic diseases are inflammatory diseases. So stop throwing gasoline on the fire. So we have to look and see where that's coming from. Ryan, anything you want to add to that one?
Well, I should have sounded smart and said inflammation. I could have said that.
Okay, Sean asked the question, do either of you know which chemicals or combination smells like mothballs? I've purchased cotton items that reek of it and have had to return because washing did not get rid of the odor.
Isn't that what are mothballs, like naphthalene or something like that?
I don't know. I'll pass that one to you, Ryan. I don't know.
Yeah, I mean, it offhand, I know like the actual mothballs, they're produced with some sort of chemical. I think it was something to do with, sounds like naphthalene, but I mean, formaldehyde just comes to mind in terms of if you get something that just kind of seems musty, like they're musky like that. Yeah, to me that, you know, that sounds like formaldehyde.
Yeah, I really don't like the smell of mothballs at all. I avoid it any chance I can. Let's see. Cindy asked, Dr. Tom, I've never heard your story of how you became a functional doctor. Oh, thank you, Cindy. Maybe next week we'll do that one. Michelle said, my 18-year-old daughter has severe eczema and has been on cyclosporin for a couple of years. It definitely helps when she has bad flares, but I don't want her to be on this continually. Thoughts on this? I also heard of Dupixent.
Haven't heard of Dupixent, but I mean, one, Michelle, I would say watch the Eczema, Psoriasis, and Skin Disease Masterclass. You'll learn a lot, but particularly one thing that we found on eczema and a lot of related skin conditions that isn't even really, I don't think, common knowledge even within the natural, integrative, holistic world is the topical staph infection component. Yeah, I mean, there, you know, on the one hand, it's all disease begins in the gut, and you got to heal the gut, and you got to work on get a good functional medicine doctor to analyze your blood work and make supplement recommendations and lifestyle changes and all that stuff. But with eczema specifically, and a lot of related skin conditions, once that condition arises, the staph living naturally on your skin is very opportunistic and kind of, you know, infects those flare-ups, so to speak. And then, you know, you get this whole, basically your entire skin becomes infected with staph. And of course, again, I mean, there's some staph always living on the skin, but it's more of a full-blown infection. And so what we found, what we learned, I guess, from especially through Dr. Sheila Kilbane, and then, you know, she put us on a protocol developed by a dermatologist in South Africa named Dr. Richard Aaron. And ironically, it was it's kind of an integrative. He uses some conventional stuff in there. So when you go to a dermatologist, they tell you, well, one, they tell you there's no hope for knocking out your eczema, and it's just something you have to live with for the rest of your life, and too bad. And they laughed at us when we said it could have been caused by antibiotics or anything like that. So, you know, of course there was that, but then they also put you on a prescription for steroids, not necessarily curatively, or of course not curatively, but just to tamp down the inflammation. But you can only use them for 10 days on, and then you got to go 10 days off, because if you use them too much, they can thin your skin, and you also get topical steroid withdrawal syndrome. And then also they do talk about antibiotics sometime, but they never really go into detail, or they just talk about it as more of a symptom management thing. Dr. Aaron actually developed a mixture where he's taken a pretty powerful steroid, pretty powerful antibiotic, but then highly diluting them to the point where you're only getting a tiny fraction of what you would just regularly prescribed, and then just continually applying that a few times a day. And I mean, people not even doing the rest of, you know, all the functional stuff see great results on that, just actually addressing the staph component, because at least this is my layman's understanding of it, but if you've got that infection going on and that inflammation, I mean, not only is it kind of a self-perpetuating thing where it's just that infection is going to keep on perpetuating the inflammation topically, but then that's also going to be sending inflammatory signals back inside your body and kind of preventing the rest of your body from healing up as well, because it's still getting this inflammatory cascade. So that was like kind of a real linchpin for us, Michelle. So I would say one, you know, and then once we learned that, and we did get on the Aaron regimen, which like I said, that involved kind of a modified prescription, but it was kind of looking back on it. And now what we've graduated back to is topical things that, you know, that have an anti-inflammatory, anti-pathogenic, especially anti-staph component to it, you know, ozonated oils, topical propolis mixtures, topical aloe, things like that are, you know, both anti-inflammatory and anti-pathogenic. Yeah, it's kind of like the missing piece of the puzzle in terms of, you know, you're doing all this, and of course, do everything Dr. Tom talks about with functional testing and gut work and all that stuff. But that's what we found. We talked to a lot of natural practitioners that didn't bring this up at all, that weren't aware of this component. And it really turned out to be the missing link for us.
You know, that is exactly why anyone that has a concern about their skin needs to register for this master class. And we've got the link here for you, because that kind of ozonated essential oils. Are you kidding me?
No, ozonated, not essential oils, but like ozonated flax oil, ozonated hemp seed oil, that sort of thing.
Ozonated oils. That is so advanced. It's simple, but it's advanced. And you're not going to learn that anywhere other than a master class like this. So if you get Michelle for your daughter, and especially because she's been on cyclosporin for a couple of years, her gut is going to be a mess. And so there's a whole rebuilding process that's got to occur for her. Just one dose of an antibiotic. I've got a paper that came out in, I think it was 2016, maybe 2015, I don't remember, but it shows that one dose of an antibiotic, not one prescription, one dose, and the alteration of the gut microbiome, the balance of the gut microbiome was not repaired after 2 years, just from one dose, not one prescription. So when people are on long-term antibiotics, they may be necessary, but the damage that they're causing also has to be addressed. And you're going to learn all about that here in this master class.
I'll also say for I don't know how, she's 18 years old. Yeah, Dr. Sheila Kildane, that's who we worked with. I can't sing her praises highly enough. She sees kids. Eczema is her jam. Excuse me, her jam, as she puts it. So I'd look her up too. Yeah.
And where is she?
Charlotte, North Carolina.
Charlotte, North Carolina. So you'll people can track her down there. Susanna asks the question, can my dog have leaky gut? Poor thing has itchy skin with scanning. Vet said he's allergic to the sun. Hello, by the way. Hello. Hello, Susanna. Yes, of course. Animals do get leaky gut. Yes. Yes. And so many people have told me when they put their dogs or their cats on gluten-free food that it turned them around. That's a very common thing. Not that all health conditions for dogs are caused by gluten, but Professor Fasano at Harvard tells us that the two most powerful triggers creating leaky gut are LPS, that's lipopolysaccharides that we talked about earlier that cause sepsis eventually, and gluten. Those are the two most powerful triggers to cause leaky gut. And yes, your dog can have leaky gut, and yes, it can manifest as his skin. And excuse me, but allergic to the sun, I would not accept that. Now, the sun may be a trigger if he's got a vulnerability right now, but I would not accept that. I'd be looking for more.
Don't forget glyphosate. That's what, you know,
Good point. Really good
Feed our
point.
dog organic, grain-free dog food. Because yeah, it's, you know, you pay a couple extra bucks for it, but you know, it's, if we don't want that stuff poking holes in our gut, then we don't want it poking holes in our dog's gut either.
Absolutely. Absolutely. Well, the hour's gone. It goes so fast. So
Good.
Ryan,
That was the wrong decision. Now
it's
I'm
okay.
shadow eyes.
It works fine. It works fine.
Yeah, a huge storm rolled in. It blocked out. Well, we've had a big wildfire that's blocked out the sun to a good degree anyway. But now the clouds have completely destroyed my light.
Well, the storm will clear the air. So
there you go.
Glad to hear that's happening. Ryan, thank you so much. And for everyone out there, please register for this event. Let your friends and family know who have some skin concerns that this is an event where they're going to pick up a lot of information. And the link is here for you. And Ryan, thanks once again for being with us today.
Thank you, Dr. Tom, for letting me get on and tell folks spread the good word. And again, you've been a huge supporter over the years. Can't thank you enough. And always enjoy talking to you.
Same here, my friend. Thank you, everyone. See you next week.